Hello everyone. Nowadays we see quite a few number of patients undergoing what is called a PET-CT scan. So let us discuss a few points about what this PET-CT scan is. So what is an FDG PET-CT scan? It is a kind of a specialized nuclear medicine scan in which there are two components. Number one, a whole body contrast CT scan. Number two, a radio labeled fluorodeoxyglucose is administered intravenously and then a whole body scan is done. This is the functional part of the scan. So there is a structural part and a functional part, and once they do these two things, they fuse both the images and then they finally come to an impression about the situation inside. This is a whole body PET-CT scan. Can a PET-CT scan diagnose cancer? As we have discussed earlier, most of the times a cancer is diagnosed based on the biopsy or histopathology report. But there are certain instances in which after doing a PET-CT scan, one might be able to tell that some abnormality that is found in a particular organ is more likely related to cancer disease. Is a PET-CT scan needed for all cancer patients? No, a PET-CT scan is not needed in all cancer patients. In selected types of cancers it is needed, and that too in selected situations in those particular cancers. So the next question is a PET-CT scan specific for cancer? No, a PET-CT scan is not specific for cancer, meaning if something is seen as a hotspot on PET-CT scan, it could be because of cancer, or it could be because of infection, or it could be because of some kind of injury or trauma. A PET scan can only pick up areas with abnormally high glucose utilization in the body. That's all a PET scan says. So that is what it is about the specificity of PET scan for cancer. So in a known case of cancer, what are the uses of doing a PET-CT scan? There are three uses. Number one, in a diagnosed cancer patient which is confirmed on biopsy, then to do the staging workup of the disease, we do a PET-CT scan. This is for staging purpose, number one. Number two, sometimes in the middle of the course of cancer treatment, we do an interim assessment of the response of the tumor to the ongoing treatment to plan the further treatment. This is a response assessment scan. This is number two. And number three, suppose somebody completes a complete course of cancer treatment and is coming for periodic follow-up or observation to the clinician. Sometimes we doctors ask for a PET-CT scan to see if there is any reoccurrence of the disease or not. That is for surveillance purpose. So these are the three reasons for doing PET-CT scan in any cancer patient. One is staging, second is response assessment during treatment, and third, after completion of treatment, to look for any reoccurrence of the disease. So next question is a PET-CT scan 100% accurate? Is it very sensitive to pick up even small spots of cancer? Even a PET-CT scan, though it is one of the best scans available as on today for assessing the extent of the disease spread in cancer, still it is not 100% accurate. It can miss cancer spots or nodules which are less than 0.4 centimeters in size approximately. It is not a must that it should pick up tiny spots of cancer, but most of the times, 95 to 98 out of 100 times, it can actually assess the exact extent of spread. So next question, is PET scan used in non-cancerous conditions also? The most common clinical application of PET-CT scan today is for cancer, but rarely, for example, in cases like fever of unknown reason and all, when we are evaluating the patient, sometimes we make use of the PET-CT scan to find out occult foci of infection in the body. So the next question is a PET scan hazardous radiation wise? Is it hazardous? Usually the amount of dose that is administered, the dose of fluorodeoxyglucose, which is a radioactive dye that is administered to the patient during PET-CT scan, it is within the safe limits. But nevertheless, soon after a patient undergoes a PET CT scan, for a short duration of time like 6 to 12 hours, they are advised not to get into close contact to vulnerable populations like pregnant women or very young children. So they are advised to keep away from them, away from the close contact with such vulnerable populations for 6 to 12 hours, and then later on they can mingle normally. Next question: can a PET scan be used to screen for cancer in an asymptomatic normal person? As on today, as per the guidelines, there is no role for doing a PET CT scan just to screen a normal patient, just to rule out cancer. Thank you very much.